There, for quite some time I've been trying to identify my vasculitis treatment plan, and it's been with limited success. But here I've pulled something together with the uncertainties highlighted. So if we start off with what the guidelines are that have been published, well, the BSR and EU LAR guidelines. These are the same guidelines followed by the Edinburgh Vasculitis Clinic, where I was previously successfully treated into remission in 2017-2018. And the guidelines suggest oral prednisolone in combination with either an intravenous cyclophosphamide or, in my case, what I received, intravenous rituximab. Now the dose levels, remember it's combination. The prednisolone is 60 milligrams per day, tapering to 10 milligrams per day in 12 weeks, in combination with rituximab, which is 2 1-gram doses given 14 days apart. It's also worth noting here that rituximab, it can be used as maintenance monotherapy or in combination with other agents. And the standard maintenance dose is 1 gram every 6 months, but that's to keep you in remission once you're already there. Previously, we tried non-drug induced remission for myself, and it appeared to work for a while, but it still fell back out. So if we have a look at the progress of how things have come together, it wasn't until day 12 of the relapse I'd been making some calls around trying to get something arranged, get something started. Day 12, the consultant, Dr. Murray, called me to tell me that, well, 4 people have contacted her and she's aware of my condition and my appointment will still be in 3 weeks' time. He also said that it would take 3 weeks to arrange rituximab, so bringing forward the appointment with her would not change anything, so it's still going to be 3 weeks. There was nothing prescribed at that point, no steroids prescribed to fill the gap. She did mention that arrangements would be made for the rituximab infusion. Those would be made now, and that would be ready for just after our appointment in 3 weeks' time. That was at day 14. In between time, I'd been for an MRI, so the consultant had a look and called me to let me know that the results of the MRI didn't show anything, and she wouldn't be disappointed if I decided to change neurology consultant. But this could add to the time it takes to be seen. When I was through for the MRI scan, I did speak with the specialist nurse there to find out what would need to be done if I was thinking about changing consultant, and that's maybe why that got back to Dr. Murray. But I'll let Dr. Murray know that I had been making inquiries, and out of all the options, sticking with her appointment was the best route for me just now, so no need to change things. While she was still on the phone, I mentioned that usually in case of vasculitis relapse, the patient would be with some kind of high dose steroid while waiting on a secondary treatment, and could this be applied to me? So she then suggested that she could prescribe this. So I went to the GPs, collected a prescription, started prednisolone, 60 milligrams per day, tapering to 10 milligrams in 15 days. Shouldn't this be 14 weeks? Okay, right. So stop steroids on day 32 of the relapse. Day 33 of the relapse is the appointment day, the first appointment with the neurologist. Okay, so it's to take me through to them. Well, this was day 33 of the relapse, and it's the original date that was set up for the routine checkup before any relapse had appeared. So it's now finally arrived. Check-up appointment with the neurology consultant at Forth Valley. Quite surprised it was more detailed. It lasted much longer than I thought. Covered quite a few things. When we did get round to discussing what the treatment plan was going to be, rituximab treatment will go ahead. It can go ahead. It's going to be in Forth Valley instead of Lothian, but that's okay. Forth Valley, they've got the experience of doing that type of infusion. They do it for other groups in there. So that's not a problem. And it's actually quite useful because I'm now finding that driving is not a good thing for me. I've stopped driving, so Forth Valley is far more convenient than heading to Edinburgh for NHS Lothian. What I did ask for was to be treated with the combination therapy like I had before, rituximab in combination with the steroid, the prednisolone. Bit of discussion around that, but it was sort of an agreement come to. So I finished off, left the appointment, still not really knowing what the treatment plan contains, apart from there's going to be a rituximab infusion. It's going to be here at Forth Valley, and we'll do something with the steroid, the prednisolone as well. Day 35, collected the prednisolone prescription from the GPs and started the course that day. Okay, we're on the prednisolone. The recommended dose was oral prednisolone in combination with, well, for me, the thing I worked last time was intravenous rituximab. And the prednisolone dose, 60 milligrams per day, tapering to 10 milligrams per day in 12 weeks. Rituximab dose would be 2 1-gram doses given 14 days apart, 2 weeks apart. Now my prescribed dose at the moment, prednisolone, 60 milligrams per day, tapering to 10 milligrams per day in 5 weeks. It's still not 12 weeks. Okay, it's half. We're getting close. Still not. Okay. It's prednisolone. And the rituximab, that would be starting, it's still 13 days later, so the dose will have tapered on the prednisolone quite a bit by then, but it's a 5-week dose. Let's see how it goes. Okay, we're on to day 36. This is the next day after collecting my prescription. I was having a bit more of a closer look at that. The repeat prescription slip now mentions the medications that are issued in the hospital as well. So that's quite interesting. It mentions the rituximab. That's a bit of information that's not been provided yet. That's handy. But having a look at it, it says that the prescription's for 100 milligram vial, and that of that vial, the quantity would be 0.01. 0.1 is 10%, 0.01 is 1%. 1% of a vial, 1% of 100 milligrams, that's 1 milligram. Doesn't sound right. I must be counting this wrong. I popped down to the local pharmacist, had a quick word with them. They didn't really want to commit to saying anything, but they assumed that it could be something like that. But apart from that, they didn't want to commit. I managed to speak to another vasculitis patient. They've got a similar prescription, but they're in remission just now, so they're on a different dose. And their prescription says they've got 500 milligram vial every 6 months. The quantity of the vial is 1 vial. My quantity is 0.01 vial. So that agrees. Half a gram, 500 milligrams every 6 months, because they are in remission. This is maintenance therapy. So that's left me with another unknown. I'll have to wait until the day of the infusion to find out more. That's uncertainty. We're on day 36, and there's a bit of time to wait. But here goes. Okay, day 40 of relapse. This is the rituximab infusion day. Finally arrived. But because of the uncertainty in the days leading up to that, I've asked to try and get some kind of clear description of what my treatment plan is going to be before we start anything. So I'm making a bit of a fuss again. Don't like doing that, but I just want some reassurance. Prescription from the other day suggests it's a 1 milligram dose instead of the full gram. So raise that question. And no, it will be a 1 gram dose. It's once only though. There's not a schedule for 2 doses. So I did mention that previously when I was treated for this successfully, it was 2 1 gram doses spaced a fortnight apart. And yeah, we usually see that. That's not, but it can be different for everyone. So, but anyway, the nurse went off and had a word with the consultant. And when she came back, she said, "Yeah, we can arrange for another 1 gram rituximab in 2 weeks' time." Wow, that's amazing, but you can't. I've been told it'll take at least 3 weeks to arrange a new dose of rituximab, so it'll still get missed. You won't be able to do it in 2 weeks' time. No, we can do this in sort of a day or two. So, okay, right, just accept that. So that's pretty close to the successful treatment level that I received before. So there's a but though. The but that would only happen if I'm still with Dr. Murray at Forth Valley Royal. So this is now the closest that we've been to the recommended treatment, the treatment that I received before that worked. But Dr. Murray was suggesting she can refer me on to Professor Hunt in Edinburgh, who's seen more vasculitis patients. He's still a neurologist, he's not part of the vasculitis clinic, so, and I would have to travel to Edinburgh. And my foot's getting worse, I'm no longer that good for travelling. I certainly haven't been driving for a while. And if I transfer over to Professor Hunt, that's just another unknown. We could be starting afresh. No guarantees. So there's not really any choice. The only option I can see here is that I've got to stay with Dr. Murray. There's no other option. I wonder if I can put a proposal together. Okay, so here it is, a proposal. As this is now the closest that we've been to what I can find to be the recommended treatment and what I'd previously been treated with before, I'm proposing that Dr. Murray documents the treatment plan at its current level, captures all the features of it that we've got at the moment. And then I would ask her to fulfill her duty of care by completing the treatment course. Stopping it just now would be detrimental in several ways. And then it takes a while to see the response, I understand that. So after 6 to 8 weeks, I may start to show signs of being on the mend. If not, it seems that a further 1 gram of rituximab can be provided if you're not yet in remission. And once back in remission, well then that's in the safety zone. We've got a buffer of time. We can identify the best alternative treatment that can be provided for my ongoing vasculitis care. Sort that out after I'm stabilised, not partway through a treatment. It's just, I can't see any sensible reason for going that way. But the steroid course, it was only a 5-week one. So point number 5, if we could, should this be extended to the recommended 12-week course mentioned at the start, mentioned in the guidelines, held at the high dose level for the period that's mentioned in the guidelines? Quick word with someone in the vasculitis clinic would clear that up, or referring to those guidelines or any of the other specialists.
really close to the previous treatment that I received before that worked. Okay, that's me come to the end of the slide deck. Thanks for listening.